We're going to wait a few moments. For those who are just joining, I'm Dr. Qazi. I'm over in Newport Beach, California. I'm going to go through this case. It's a nice case because it really showcases for really the public just the kind of scars this patient has and what the right treatments are for him. So I want to kind of go through that because this is a patient, he's letting us share his overall just like initial photos. And he's somebody who was recommended, I believe, 6 Morpheus8 sessions. So he's letting me share this and kind of talk a little bit about this. And I believe he's probably going to be coming on tonight too, just to kind of see what I would recommend. But just want to showcase this, especially because it's really kind of interesting to me how people would try to push something like Morpheus8 for a patient like this, and that's what he was recommended. So I want to talk about this a little bit. This is not a before and after. This is just a patient that, or a person who showcased his scars, and he's letting me kind of just talk a little bit about what I would do instead, and why Morpheus8 would potentially be really problematic for him. Hi, Miriam. How's it going? I hope you're doing well. I'm just showcasing right now this patient who was recommended Morpheus8. So I want to talk to you a little about that. What's my opinion of hydrocortisone for a cystic breakout? Are you talking about like a hydrocortisone cream? I would say that that's probably not going to help too much. You could try to do like a little bit of silicone tape. Actually, that could actually be a good idea. As long as you are otherwise it's not terrible cystic acne elsewhere. But if it's like a small little breakout here and there, silicone tape actually at nighttime actually does help with inflammation. So just something to consider doing. Just kind of a quick fix. If you have like a public event, you could do a little drop of Visine also on the acne if it's red, and that could help calm it down. But otherwise, just do a cortisone shot. That's going to help you out for cystic breakouts. That'll be a good idea. Over our practice, we also do the BBL, which works out really well. So it works out in terms of just killing that surface acne. So it works out really well for that. Visine, Visine. So it's just like a little quick fix for a temporary type of solution for like that redness. It could be a good idea for you. Let's see here. Hey, do acne scars have a cure? Well, not really a cure, although some scars do disappear when we're working on the treatment. But there's things that we could do to make it a lot better. So what we do really is, especially what I did today, I did subcision, I did TCA cross, and I did ablative lasers as well for this. So I wanted to kind of go through the things that are appropriate and effective for someone with these kind of scars, because this is actually a very common scar type that I see. This patient, you could see really deep scars. You can see there's a lot of volume loss over here. And he's someone who was recommended doing Morpheus8 sessions. So yeah, this is not a results photo. This is just a consultation type of process here. I just want to talk a little bit in a way, just talk about why I would never do Morpheus8 on a patient like this. So for those just joining, this is not a results photo. This is just sometimes, people submit things to us and also just request me to kind of talk a little bit about it on the live. So in this case, I want to talk a little bit about this patient because someone had told him, he said he went to a dermatologist and they recommended 6 Morpheus8 sessions. And he was also saying that they had said that they would get 50% improvement after 2 sessions of that. So it's really a wild claim to me. Like if that's actually what was the case, I'm not sure if that's what happened or not. But it's really unfortunate if that's the case. Because this, if you did Morpheus8 on this really would cause more fat loss. It could likely cause more fat loss, I should say. Reason why is because you have to use a lot of energy with it. And when you end up doing that, you already have a lot of fat loss, a lot of volume loss, and that could potentially melt fat. And, they have marketed it as being something that could work on like the abdomen area for fat loss, things like that too. they kind of say that like it'll help with that, and this is let's say for skin tightening, but also we know that it can melt fat. So imagine now doing that for when you have to do it for scars, and you have to go really aggressive for that. You potentially could really melt more fat when you're already lost a lot of fat there. The other thing is that this patient, he's a Fitzpatrick, it looks like 5, and that actually is another risk factor with Morpheus8. You could potentially, it could result in a post-inflammatory hyperpigmentation, and it's not really going to give you enough result for these kind of scars. So these are deep ice pick scars. These are scars with a lot of volume loss. So I would not do Morpheus8. And I'm going to put on text over here because there's some people on the different platforms that are confused by this. So if you could just bear with me, I'm going to put some text up out here just to showcase that this is not a result right here. This is sort of like why I would not do Morpheus8 for these kind of acne scars. I'm going to actually put that up there so to give you guys a heads up about why I would not do Morpheus8 for acne scars, because I get that question every single day, so many different times. And I think it's really unfortunate that, a device that otherwise has, I think, good results for skin tightening is pushed inappropriately for something like this, for scars like this. And, probably once a day or so, I have a consultation with somebody who was told to do Morpheus8 and for their scars, and potentially even did some of the Morpheus8 for their scars, or did radiofrequency microneedling for their scars, and their scars were like this. So that's why it is something I care a lot about, because it just I think we should put down that that Morpheus8 does not work for scars. So I'll put that on right here over here. So let's see. Adrian saying, I'm going to have erbium done. Is that an okay laser if I have melasma, want to treat my scars? It's okay. It depends on how they're doing it. You want to do something without much heat. So erbium is a good idea for that. I had a patient today that I actually have been working on for his pigmentation, his melasma, and we've done it now for 6 months or so. He doesn't let me share his results, but his scars look significantly better. So it is something that I push to say that, you could do the Pico laser for scars, but it does actually help with it. His scars do look better, and he didn't trigger his melasma. In fact, his melasma got significantly better. So just to give you an idea that sometimes we can do things that are non-ablative, like something like a Pico laser for sometimes scars. And occasionally I do recommend it for, like, if it's relatively superficial, things like that, I could actually get that improved with the Pico laser. And especially I will recommend it if you have like significant melasma, like this patient has significant melasma. He's a Fitzpatrick 5 patient, a patient of Indian descent, and significant melasma, post-inflammatory hyperpigmentation as well. So very complex type of case. He wasn't really particularly worried about his scars, but his scars looked a lot better. So this is like an added bonus here that we did, because I'm a scar doctor too. So I was like, here, we worked on your scars there too. Someone saying, Happy saying, can this guy do CO2 laser? Yeah, you could. You could do it around the edges of the scar. That's fine. You could do it for the ice pick scars in a certain way, like to kind of close it a little bit. More likely though, what I would probably end up doing for this patient, if he was my patient, I would probably try to excise some of those scars. Some of those scars really do need excisions. And then on top of it, what we probably need to do we definitely need to do TCA cross. And we need a lot of we need a single session with me of subcision, and then potentially something for volume at that time, or later on, probably ideally something like, for example, fat transfer. If he has fat, Sculptra, Bellafill, something. He needs a lot of volume in his case. So a lot of volume destruction. Morpheus8 is a terrible idea for that, because I'd be really worried about volume loss there. And I'm really clear on saying this. I think that there's enough evidence in my mind to say that if you're using too much heat with it, with Morpheus, which you kind of have to do for scars, that you could potentially cause volume loss then. So, I would really strongly advise against that. If you have scars like this, don't consider doing something like that, because it's really, and then, he was told that he'll get 50% improvement after 2 sessions. I don't know where that came from. Where did somebody say that he's going to get 50% improvement there? I'm not sure. How do they find that out? Like, where did that come from? Because I never see any results like that, 50% improvement. Let's see, laser CO2 for boxcar scars. Yes, you could do CO2 laser for boxcar scars. We do around the edges of the scars, really to help out a lot. So we do that, and then but of course you still want to do something to lift up the scars. You want to improve the scars as well. So what we may need to do is something like Bellafill, for example. You may need to do a little bit of filler as well. So it depends on what's happening with the Boxcar scar. If it's particularly deep, you could potentially excise it and do something what's called an elliptical excision, and then make it into a more narrow scar. That could be an idea there for you. Let's see, can I use hydrocortisone 0.1% for irritation on my face from tretinoin? Sometimes probably wouldn't recommend it that way. Just do more moisturizer. That's probably all the issue is. Let's see here. Best treatment for boxcar scars, not CO2 because I have a trypophobia. Well, you probably could do just Bellafill, but you may just have to repeat that a few times. Just do Bellafill, repeat that a few times like that. Let's put it for these type of scars. Let's see here. Hi, Veronica. How's it going? What would I do for this patient above? So the things I would do is like I was talking about, I would do TC across. I would do excisions. I would do subcision. And then I would probably do laser for some of the edges there. I have to kind of see the photos a little bit blurry for some of that aspect, but I think I would probably end up doing some laser. And then definitely, if he has some fat, do some fat transfer. If he doesn't have that, then like something like Sculptra, Radius, Bellafill, all good options here. Let's see here. I know I missed a bunch of things here. Why do some excisions open up during the healing process? It depends on how much tension there is in the face. So in areas, for example, around the nasolabial fold, it could potentially stretch out a little bit more. So that's possibly a reason why you may end up having some of that. But it does actually typically contract over time. But initially, like you said, it could get a little bit wider before it gets better. Sometimes for the first 4 to 8 weeks, it could be like that. Emily Chow saying, hi, I have light brown and pink spots left over from acne. What's some products that can help? Probably the easiest thing to do is 10% azelaic acid. That's probably one of the best options. Queen NB saying, views on Panoxyl face wash and exfoliant. I don't love exfoliant in general, but the face wash is okay. It's better than the cream, if that makes sense. But there's a lot of better options. I usually like topical antibiotics. S Valley saying, that guy looks like me, I need the same treatment. So this patient, this is not somebody I've done anything on. He just wanted my advice on kind of what happened with the scars. So I want to help out with it because he was recommending Morpheus8, which I want to educate people is not going to help for these type of scars. It's not appropriate for these kind of scars. So hopefully that could give you a better understanding for if you have scars like this. Don't go down the route and don't accept when somebody tells you to do something like Morpheus8. I'm telling you right now, they really have to prove it. I want them to prove it, and they should showcase to us over and over and over again that they get phenomenal results with Morpheus8 because I think the risks are not worth it with that. I like Morpheus8 for skin tightening, but not for scars. So every tool has its purpose. And I see all the time, every time I showcase Morpheus8, people will say, well, it causes this problem, it causes that problem. Well, it depends on how you do it. It depends on if you're doing it appropriately. That's what matters. It's like what energy level you're doing it, how you're doing it, and the depth of the needles. And it doesn't matter if other people say those things, that they could do it that way. And they're going to do it for you have scars like this and they're telling you that they're going to be able to give you 50% improvement. They have to prove that. I mean, and I'm not talking about like photos where it's like, the ridiculous photos that we see out there for acne scars. I'm talking about like proper photos that are going to showcase that this is the actual appropriate treatment for this. I think that really is. Does tretinoin work on these? Well, it'll help a little bit, but these are deep ice pick scars. Not going to help too much there. And not going to really help too much. Baby facing Morpheus gave me hollow under eyes, and that's something that I'd be concerned about. Exactly. That would be something I'd be worried about for someone like this. So it's really not appropriate to do that for a lot of patients when there's a lot of volume loss. Happy Peace is saying, what about punch excision? Punch excision is great for this. This would be a great patient for punch excision. You could do multiple punch excisions in this case. I likely wouldn't do the ones along the nasolabial fold, but in the mid-cheek area along the immediately underneath the cheek, that's where I would probably do some punch excisions for this patient. Priest is saying, yeah, Morpheus8 has 50% bad reviews because so many people complain about fat loss. It's it's unfortunate because it does work, like I said, for skin tightening. It is good for that. It's just the problem is that people are doing it inappropriately. every tool, it shouldn't be used for every single patient for every single problem. That's why I have so many different tools, so many different lasers, so many different things that I use in my arsenal. And it's like, to me, it's upsetting when I see this stuff. It's actually sad to me. I actually get sad when patients tell me that they did microneedling and they did Morpheus8 or whatever other RF microneedling, Profound, all the other brands that are out there. And by the way, I'm not just picking on Morpheus8. I'm really talking about all radio frequency microneedling devices. It's just that Morpheus8 is more common. It's something that a lot of people know about. And it's, in my mind, I think was pushed inappropriately for the wrong types of patients. And so someone like this he went to a dermatologist, and the dermatologist told him to do 6 sessions on Morpheus8, and after 2 sessions he's going to get 50% improvement. That is really astonishing to me. In fact, I think that it could be really problematic. I think that he'd be really upset if he had more volume loss. And so I just think it's my duty to inform people, really. I have a duty to inform people about certain treatments that are not going to work effectively for this stuff. And it's not because, I have Morpheus8. So it's like, I have it. It's like I use it for skin tightening. I like it for skin tightening. I like it for those things. But it has to be used the right way. And I don't use it for these kind of scars ever. Sometimes you could use it if there's a lot of skin laxity. You could try to help with that with Morpheus8, even with scars. But I've had people that told me that when they do scars, they're like, think that they have to do max settings and this and that. And so many people message me, so many practices message me, asking me about what do I think about Morpheus8 when it comes to acne scars. And I just wish the whole thing pushes out. That's what I wish. Because I want this to be like more educated. I want us to actually really know about this. Emily is saying, I missed your question, Emily. Sorry. I know I missed a bunch of questions here. So Emily's saying, I missed that. Where did Emily's go? So several questions back there, I think. So if you could repeat your question, Emily. I'm sorry I missed you. Rebecca's saying substitution CO2 and TCA cross works really well for deep ice pick scars with rolling scars. Someone like this, for example, that could work really well. So I would probably do it. He's Fitzpatrick 5. Got to be careful with the CO2 laser. We could do it, but it would really be like justified if there's really thick scar edges. And I think he probably has that, but we'll have to take a look. More likely, I would probably push more like an erbium laser in this case for this patient. Can people with scars one day have good baby-looking skin? Sometimes you can have better skin than people without scars. That's the thing. Sometimes it actually could look better than people without scars. Calray is saying, I've done hyperdilute radius 2 months ago. When can I do Bellafill? I'm thinking of coming to see you. You can do it now. Why not do it now? I'll be able to help you out with that. So let's see what's happening with you. If you did dilute radius, I could definitely try to do something more permanent like Bellafill. It's not a bad option. I hopefully you like the radius. I love dilute radius, honestly. I think it's a great option. Not just for anti-aging, but for scars. Also, it's really nice in the neck area. Works really, really well for that. Let's see here. I missed this question though. It says, can people with these type of scars one day have baby-looking skin? These scars, probably not, but like a lot of scars you could, mostly more mild scars. Moderate scars potentially, but like some of the rest of your face is going to look amazing with it. But the areas that the scarred areas are, it's not going to be perfect, really. It's just not. So these kind of deep ice pick scars like this, it's just not going to get to perfection right there. Even if you do a ton of stuff, it's not really appropriate to say that that's going to be this. So sorry, I misunderstood the question. I thought you were just asking scars in general, but these kind of scars would be very, very difficult, if not impossible, to achieve it currently with the current ways we do things. So maybe someday, I'm open to like seeing if there is a possibility. It'd be really cool. But let's see. Let's see here. T. Chen is saying, hi doc, when you do erbium laser, do you laser the entire face or just the scarred areas? I usually do most of the face where then it has like texture issues. If you request me to do like your rest of your full face, I'm happy to do it. Only areas are just really typically extra or just around the eyes. It does take a little bit. I have to change the handpiece. We use a different way of doing that. So just let us know if you want to go around the eye area as well. But usually I do the full face. Sometimes I don't want to use too much heat, darker skin types especially, because I don't want to cause pigmentation issues. So it just depends on what we're seeing and like what you're expecting for the laser. So just talk to me, communicate with me. I'll be happy to help you with it though. Audrey's saying, how likely is it for scars to retether with cannula subcision? I don't think it's likely at all. I think that people have to prove to us that it does retether. I've never seen it retether ever. And so I don't believe the retethering thing. I think that just wasn't done fully. That's what the thing is. And suction, I worry about just a hematoma potentially with suction. Let's see here. Erica Dawn is saying, paid so much just to have the opposite of skin tightening. That's possible because you weren't the right candidate for it, and it caused a little bit of volume loss, and the fat loss caused a little bit of loose skin afterwards. I hope that didn't happen, but it's possible. Let's see here. Does salicylic acid cause tiny non-healing red spots? It possibly could, like a little bit of the post-inflammatory erythema, but usually that does go away. So it's not that it's non-healing, but it'll be there for a little bit of time. Let's see here. Ruby's saying, so can Morpheus8 be used on the abdomen for skin tightening? Yes, it could. Yeah, that you could do. I'm fine with that. Do that. That's okay. If you're the right skin type, that's okay. But otherwise, don't. What I'm upset about really is that when people are pushing it for scars like this, that's really inappropriate to me. That's the thing that is not right and fair to me. Let's see here. I know I missed a bunch of stuff. So if I missed you, feel free to re-ask the question. Audrey saying, that's good news. I'm getting cannula subcision in a month. Hope it goes well. I hope it does too. It depends on how they're doing the subcision. A lot of people go to a lot of places and it's not done like completely fully, and so it depends on who you're going to. Hopefully you're going to somebody who does a lot with it and is really good with subcision, because that could be really necessary for you. Paul is saying, you think raw milk can cause acne? Well, milk in general, dairy in general could do that. And raw milk is pretty much I don't know why you would do that in this day and age. It kind of explained to me why anyone would drink raw milk. Pasteur really discovered something really important and saved countless lives when he found just to pasteurize things, and that's what they call it now, but basically just nuking all the bacteria that's in there. And so you don't get something like listeria. And listeria could kill fetuses. It really could. It actually has I know personally someone who that happened to, where like a listeria infection actually caused miscarriage. So be really careful about that. I'm not sure why you would drink raw milk, honestly, in this day and age. Happy Peace is saying, is pinhole laser for burn scar also effective in this case? Not for this particular patient. No, this is a Fitzpatrick 5, would be really risky for post-inflammatory hyperpigmentation. Honestly, I'm in general, I'm not really a big fan of that, because I'd be worried that when you're doing the laser with that kind of intensity and someone, especially in this kind of skin type, you have to go very, very deep for ice pick scars. And you're using a laser and a pinpoint spot like this with a high amount of energy. I really do get concerned that you potentially could cause either the scar to get wide, and then of course more post-inflammatory hyperpigmentation risk. I think there's better options out there, just excisions, just doing that will probably be better. And then you could always do laser more on the surface there, but I probably wouldn't really go too deep with the laser, especially in a patient like this. Fitzpatrick 5 would really something we'd have to be really careful with. JC saying, would IPL laser be good for PIE scars after taking Accutane? Yeah, that depends. What's your skin type, JC? That's what the question. That's what matters actually. Let's see here. Miss Margaret saying, what are the chances your dark skin patients with pitted acne scars get pigmentation? We don't have anyone with permanent hyperpigmentation, so I don't. So I guess 0 chance. I'm really careful with what I do. I really make sure that we pre-treat the skin appropriately, and I have a lot of different ways to clear up pigmentation afterwards. And if we need to, we could always use the Pico laser to sort of rescue the pigmentation if it's kind of going a little bit longer. But really, using sunblock, doing the things I talk about, which is staying away from the sun and just following my instructions, you're going to be able to be okay with pigmentation. I followed up with so many patients this week, so many patients, I think a couple dozen from the last month or so, and nobody really had a problem actually with pigmentation. Amber is saying something that you asked me a question, but I missed your question, Amber. Just feel free to ask me again. I'm sorry I missed that. User 25 is saying, can Bellafill be used on the temple? I heard it can be risky because there's not much fat. I love Bellafill on the temple. I love it on the temple. I think it's one of the best products ever on the temple, actually. So I'm a huge fan of the temple area. I think it solves volume loss. It helps a lot for scars. The temple area, I have patients who are marathon runners. I'm not a marathon runner, honestly. I don't run at all, unless it's like some emergency or something like that. But like, people that are marathon runners, they basically, see a lot of temple hollowness, and it goes really rapidly, where they lose a lot of that volume. And then when they're scarred, if there's any scars over there, you can see that indentation really quickly. So I would, strongly recommend doing something to support the area. You could do Sculptra over there. You could do Bellafill, or you could do hyaluronic acid fillers. But Bellafill, honestly, I think is the best product because it just supports it always. So even if you are running again or anything like that, you lose a little bit of weight, you're still going to have some support in your tissue. It's really nice for that purpose. Let's see here. What was used on the client above? Well, this is not, I didn't end up doing any treatment on this patient. This is not a before and after result. This is just a patient who was basically showcasing his before photo, and essentially was told to do Morpheus8. I just want to tell people and educate people, these kind of scars, don't do Morpheus8. That's the whole purpose of this talk today. This is my TED talk today about how you shouldn't do Morpheus8 in certain kinds of scars, especially a vast majority of acne scars in my mind, unless you're doing subcision, you want to do a little skin tightening with it, that's different. But by itself, it's not going to help really for these kind of scars. It's really not. So I think it's just really important just to be able to say that to people. Michelle is asking, how long after Accutane can I have cannula subcision? We could do it even anytime, actually. That's okay. I don't have any problem with doing subcision while on Accutane. What's best for acne rolling scars? Well, that's where we just were actually with the subcision. That's the best thing for especially deeper rolling scars. You could do more like something like Bellafill potentially. That could be an idea as well. Let's see here. SMG is saying nothing is working for my acne. Should I get azelaic acid to try? Well, talk to somebody, because if you have acne, I want to prevent you from getting scars. A lot of different options. But go to somebody that's going to work on your acne, get that under control, because I really don't want you to suffer from scars and have things like this to happen to you, because I deal so much with that consequence. So avoid it really as much as you could. Try to help getting that under control. Azelaic acid probably is not going to be the best option if you have cystic acne. That's more for like very mild scars. Hi is saying, can I use fully ablative CO2 laser on pitted acne scars for Fitzpatrick 5? I probably would not. No, I probably would not do that. Bruce is saying, also wondering how you feel about clear and brilliant laser for acne breakouts and PIH. That's a loaded question. There's a patient on our page. Let's see, what day was that? Just like a couple days ago. I think yesterday's patient. You can see like the full 20 slide photos that we put up there of his treatment process. He did, I want to say, 20 clear and brilliants. Okay, a ton of clear and brilliant. I can't remember exactly. I think it's like 20 clear and brilliant lasers. And it did, like, you could ask him, you could talk to him about it, like what we were, he comes every once in a while when he's live on the camera, you could actually ask him and he'll tell you that it didn't work, and that's why he came to me. So I think, just pay attention to that, because people are going to sell you these kind of things, these packaged stuff. It's a total ridiculous nonsense thing that people are pushing for inappropriate lasers, inappropriate devices for these scar treatments. T. Chan saying, do you find that Accure laser works better than topical retinoids? Well, it depends on what kind of acne you have. If it's just mild acne, or just like a mild little bit of oil production, then sure, you could do a topical retinoid. But really, if you have more cystic acne, moderate to severe acne, then the Accure laser would be an excellent option for you. It's really hand in hand with Accutane at this point, so it works really well. Again, I tried to talk to everybody today. Hopefully that I didn't miss anybody that did the Accure laser. And people that have done it now the second session, some of them, they're saying already significant improvement already here. So really nice. Actually, I had a patient that said she loved it. She came in today. She had done one session a month or so ago. Now she's doing her scar treatments, and she's like, I was actually excellent for her. So she's like, loved the result already. So awesome. Just did it for a few weeks. Let's see. I know I missed a bunch of questions here. Angelus is saying, what causes these deeper ice pick scars? I don't pick my skin and have these. It's genetic, honestly. Sometimes it's due to picking, but really it's genetic. Some people just respond really poorly when they have acne, when they have the bacteria on the surface of their skin. That's why you can't judge people like this. everyone should just learn not to judge people like this. This is not something that's their fault. Don't assume that it's because they weren't washing their face or weren't doing the right products. Also, a lot of times, a lot of my patients didn't have access to it. Like, insurance-wise, insurance sucks. Insurance is the biggest scam in this country. It's the biggest joke in this country. It's just, and it's like, how do you expect somebody to pay for some of this stuff sometimes, especially if they're initially, if their parents were in a lower socioeconomic status or something? It's really tough. And how do they get access to that? How do they get access to the stuff that, the physicians that are going to provide the appropriate stuff for them? Really tough for some people. Really is. I had a patient, she had flare up of rosacea, really terrible rosacea. And, it was like really painful, looked really bad, and it was superimposed on top. Was what's called a MRSA infection. It was a staph infection on top of it, and she went to urgent care, they provided inappropriate antibiotics, and they put steroid on her, and it was like it got worse, of course. So then she came into me just like kind of, we got her in, we saw what was happening to her face. We just put her in there. And then after a few days, it cleared up so quickly with appropriate antibiotic use. So it's really sad that she goes to somebody and they do inappropriate treatments like this. So just imagine now, she didn't have access to me before. She actually didn't know me or anything like that. And now she potentially was now suffering for weeks and weeks. And now she would have had new scars due to that terrible flare-up, the MRSA infection, because someone did inappropriate antibiotics on her. It's terrible. And as patients, you trust that this is a person that's going to know how to do antibiotics. I'll tell you a secret. I'll really will. I'll tell you something. The vast, I don't want to say necessarily the majority of people, but a whole ton of physicians and, people that practice medicine do not seem to understand antibiotics as well as you think that they would, really. And it's unfortunate because infections aren't treated appropriately. And so I worry sometimes about that because it's like a lot of people do, go to somebody that they trust at an urgent care, or they go to even their primary care physician, things like that, or a new person, and they give them inappropriate antibiotics for their infection. And it's like either too broad spectrum or it was something that wasn't treating the actual infection that was there. And then to put steroid cream on an active infection like this with rosacea, totally, it's really inappropriate. And so it's really, I want to tell people that, I used to have this whole thing. I was telling you guys about this before, that I used to think that I shouldn't really say too much about my own peers too much, because in this world, who could really say maybe there's some aspects of it that I'm missing or something like that. Then COVID happened, and I started to realize that so many of my own physicians are just really incompetent, to be totally frank. And really just don't seem to understand medicine, and made really poor logical choices consistently during COVID time. And then I see what they're doing with things like this, these packages. So this patient went to a dermatologist and told them to do 6 Morpheus8, and he's going to get 50% improvement after two sessions. That's really inappropriate. And it's time just to try to pull the wool over this. Let's just open up people's eyes here and make it clear that some things are just let's start paying attention to it and look at this and a little bit more objectively. And maybe potentially, talk to other physicians, or you could come on my live or something like that, and I'll just tell you, what is actually an appropriate treatment. This particular patient, I'm glad, hopefully he, didn't end up doing any treatments and didn't waste that money doing that, because it could have actually caused more complications, more problems for him. So that's kind of what I want to showcase for people. I want to tell people about this stuff because it's my patient, just a week and a half ago, I can't believe that they put the wrong antibiotics on her, and then they gave her a steroid cream for this problem, and it was solved just in a matter of a couple of days with the right antibiotic. So it tells us, just what's going on out there. Really, it's poor medicine. And yes, I know that physicians are overworked. I get all that stuff. I understand that, but there's also an aspect of it where it's just that there's not really this ownership of their work. Even when I'm when I do regular medicine, when I used to work all the time, and I was doing everything with it. And it's there's a lot of ownership with making sure that you succeed in this patient. And it's frustrating as hell. I had a patient that, I was a resident, and we had worked on her throughout the whole day, really for almost my entire shift. She was 22 years old, and we did so much CPR for her, so much work on her. and then it's like we hand her over to someone other physician, and then, you know, it's like, did they work on her properly? Did they really look at her properly? And then she was, you know, the morning time I come in and she's gone. And it's like, it sucks. And it happens a lot. It happens so many times. It's like you were sitting there and you were saving someone's life and you put your effort into it and you did everything you possibly could. And then you hand it over to a physician who's less competent or potentially just doesn't care enough about things. And then it sucks, actually. It's like, it's really, really unfortunate to see that, because then it's like you sit there and you work so hard on saving someone's life and somebody just didn't care enough and they put the wrong antibiotics on, or they did the wrong thing. It's like, why did you not call this person? Why did you not call neurosurgery? Why did you not do this? And there's no explanation. And it's like, and don't tell me you're busy. It's like, just like, there's no excuse for some of this stuff. It's like, just do this at a very high level every single time. These are real people, this is a real person in front of you, and make sure you do this at a very, very high level every time. So it's like, that's why I like having my own thing, because it's really about like just up to me. Like, I really need to make sure that I always achieve an excellent, amazing result for every single person that comes through me, and give you a very clear, honest approach, and try to work on making sure that we can solve the problem that you're coming with. And that's like been my approach for this whole time. And that's that's why I got out of big groups and things like that, because I just didn't love that setup. I didn't love the fact that like I cared about a lot of stuff, but like the person I'm handing it off to may not care as much. They just don't care. A lot of doctors just don't seem to care sometimes. They really don't. And I talked about that before. It's like some doctors, you talk to them, and they seem to think that they're in a different class from their patients. They seem to think that they're just, the ruling class, when they're like, it's a joke. Actually, everybody knows. Anybody knows that's like dealing with physicians or owns doctors, things like that, knows that physicians actually really are pretty low on the totem pole in the healthcare world now. It's like pretty obvious and pretty clear that really physicians should be considering themselves more within the working class people, instead of like this elite type of, this higher up, the ruling class type of world. And the problem is that because of education, things like that, they just sort of just assume that, what we know is the best way, and this is the right way. But, maybe just kind of talk and figure out what the exact problem with the patient is, and take a step back. Maybe this is not your world. There's certain things, I always talk about that. There's certain things that I'm not an expert in. Like what I talk about, I know a lot of. But there's some things that like I may not necessarily know that exact thing, but I'll find someone that does, or find the answer for you, or try to help you with it. As a physician, I could do that. But it's like, I'm fine with saying that, some things I'm not going to be able to treat. So the person who this person went to a dermatologist who clearly doesn't specialize in acne scars, or doesn't do enough acne scars, and claimed that they would get 50% improvement, that is really unfortunate. And they should have just said, hey, there's a physician who could do this kind of work. And actually, there's a lot of dermatologists in our area, a ton of dermatologists in my area who refer to me, because they know that they don't do as much of that, and it's totally fine. I send patients over them for things that I don't do a lot of, a ton of stuff, dermatology stuff all the time. And so it's like, it's no problem. Like there's a ton of stuff that I do a ton of, and then there's stuff that I don't get involved with. And like, it's totally fine, and it's totally appropriate to have that kind of relationship. And if we get rid of a lot of, the way that corporate medicine is, I think we'll kind of get to that eventually. But the way it is set up right now, it's like, you can't really do it with the way the insurance system is, the way the profit system is, the people are compensated in hospital settings, stuff like that. It just doesn't work that way, unfortunately, in big groups like that. And these groups are obsessed with trying to sell to private equity firms, all that stuff. And it's just like, they're just driven by just trying to push up profit as much as they could, instead of like actually like trying to get like a solution for people. And that's why if you look at all indicators, our healthcare system sucks compared to first world countries. It sucks. It really is. It's like one of the worst in like the OECD. So terrible. Clearly we're not doing the right thing. And the trillions of dollars that we're spending somewhere else probably could be spent in our healthcare system. Would CO2 laser in itself help with rolling scars? Not so much. Probably not so much for that. Can silicone tape also be used as silicone scar sheets? Yes, yes, it could be known as that as well. Let's see here. I appreciate all of you guys. I know I missed a bunch of stuff, but can pitted scars be 100% treated? Some more superficial ones, these deep ones, not so much. So hopefully this helps you out with this, though. Hopefully this is gonna help you with it. I do want to say one thing, because a lot of patients come in from the lives, things like that. I'm happy, like let me know sometimes when you are commenting, so I kind of put like a name to your face, or face to your name, I should say, but like kind of tell me a little bit, because it'll be kind of nice, because of like a small little community that we have over here, and just kind of as it grows and grows, it's really, really nice. And when I'm doing the procedure, obviously I talk a lot on these, but when I'm doing the procedure, sometimes there's areas where I'm concentrating and I'm trying to like focus. So don't be like, don't feel that it's like a personal thing, but sometimes I just do have to really concentrate and making sure that I'm doing this at an exceptional level every single time for you. Like I'm doing TC across, for example, things like that. So I'm making sure that I'm like very, very concentrated. If I'm talking to you, it's because I'm like, there's a spot now that I could talk, but like, just so you know, like it's not like that I don't want to talk sometimes. Like just like hopefully you guys don't feel that way. I don't think you guys do, but just like so you know that I do multiple cases a day, but I love having everybody there. But like sometimes it's like I want to be like focused, and when I'm focused, like for certain things, I don't really talk too much. Just so you guys know. But I'm happy to talk on here things too. I'm happy to talk during the consultation, during the after the treatment, things like that. I'm happy to talk a lot about that stuff. I talk a lot, as you guys can see, but sometimes when I'm doing the procedure, I like to just stay focused on like exact type of thing. And when we like could chat in times, I sort of let it know that this is a time that we could really go forward. So don't feel like I'm not communicating with you while we're doing the treatments, even though you come on these lives and things like that, and we talk on here. I'm happy to still talk with you. It's just sometimes when I'm doing the procedure, I'm sure you guys appreciate it too, that I'm focused, I'm concentrating, and I'm going to make sure that you get a really, really amazing results. And that's what I'm going to do. I get this like, oh, you got this really, really well. So we'll get this constantly, and we'll keep on working on this. I know I saw a bunch of questions. I'll try to hit some of those tomorrow. And we went a little bit over my time, so I'll try to hopefully help with that. I'll just answer this last question. Miss Margaret saying, can you drive after the treatment? I live an hour away. Yes, you could. You could drive. You don't have to stay in town. Just send us photos. We'll be happy to help you with that way. All right, guys. Thanks so much. Really appreciate you coming on. I will see you again tomorrow night. Appreciate you guys. Take care.